Most people pay out of pocket for abortion care, and a study by Silver School of Social Work researcher Ortal Wasser found that 42% of abortion patients incurred catastrophic health expenditures,
or CHE. This happens when healthcare costs force a household to sacrifice basic needs like food or housing. 2 out of 5 participants experienced abortion as financially catastrophic. For those traveling out of state, that number jumped to 2/3. Unsurprisingly, those patients, out-of-state patients, had higher overall costs in nearly every expense category. We also discovered that experiencing CHE was significantly associated with higher levels of stress, anxiety, and depression at the time of the abortion appointment.
Notably, this study was conducted in 2019, before the 2022 Supreme Court decision that overturned Roe v. Wade. Reports indicate that the number of people traveling out of state to access abortion care has risen since then, suggesting that the financial burden may have worsened since the study was conducted.
We hope this research sparks important conversations about access, affordability, and equity in abortion care.
Thanks to advances in prevention, diagnosis, and treatment, many cancer patients receive good prognoses and are living longer than ever. However, some tumors still spread throughout the body through a process known as metastasis, which makes treatment challenging. For that reason, metastatic cancers, and not the original tumor, are responsible for most cancer deaths. NYU biology researcher Carlos Carmona-Fontaine and colleagues have turned to 3D printing technology to better understand that crucial moment when a relatively passive tumor cell starts to move and metastasize. Most metastatic cells come from deep within tumor tissues where oxygen and nutrients are scarce, making them hard to observe in the lab and in patients. That's where the 3D printed model comes in.
The tiny chamber can mimic different environments, including those that allow cancer cells to grow, which enabled the researchers to watch the tumor cells' behavior under different conditions. The researchers were also able to add cells that are known to partner with the tumor during the metastatic process to observe how the cells interact.
Their study showed how a type of chemotherapy that effectively targets tumor cells under normal conditions fails to act on the resource-deprived tumor cells. And researchers hope this new method of illuminating the problem might pave the way for more effective treatment of metastatic cancers in the future. How to reduce traffic in Manhattan remains a hotly debated topic. NYU Tandon researchers recently took a look at another policy designed to ease congestion on the city's busiest streets. A 2019 ride-hailing surcharge imposed on Ubers, Lyfts, and taxis to see if it had the intended effect. Assistant Professor Daniel Vignon and PhD candidate Yan-Cho Lee analyzed over 300,000 ride-hailing records from NYC's Taxi and Limousine Commission and 1 million traffic speed measurements from Uber Movement and other stats.
You look at the number of trips in the zone affected by the congestion surcharge before and after the policy, and you have these changes and these shifts. People stopping or canceling their trips, or maybe going to city bike or the subway, but does that have an impact on congestion at the end, right? And it seemed there was no significant impact detected, right?
No significant impact. So why the travel demand decreased, but the congestion doesn't change? One possible explanation is because the number of the ride-hailing fleet is a fixed number. So even if the travel demand decreased, but maybe there are more empty vehicles, they still are driving around the street. So that makes the congestion level doesn't change.
What the study did reveal is a complex relationship between income and transit access. In wealthier neighborhoods, the surcharge resulted in a minimal reduction of ride-hailing use, even with other transit options available, such as subways and city bikes. Lower-income neighborhoods saw sharper declines in Uber and Lyft use, even though there were fewer alternatives available.
The policy's intention is great, but whether it can just reach the outcome it's intended to be, that's kind of need a careful consideration. Maybe people can use this kind of money to improve their public transit infrastructure building.
For more on these stories and all the latest NYU research, visit nyu.edu/news. I'm Jade McClain, and I'll catch you next time on Brainiacs.